Hi, Mike.
Hey Andy, how you doing today?
Good.
Well, you sent me all kinds of stuff this week. I don't even know if we'll get to it all, but we can try if you want.
Yeah, I think I'm looking forward, Mike, to. I've set a date since no one else will, and it's actually a late date for me because I think it should be now. But I think we have enough information that Easter Sunday should be our full opening unmasking day here in Rhode Island.
Yeah, Easter had some. Well, President Trump was wrong about that last year. So remember, I mean, that was. You look back on it, that was kind of silly, maybe to think that within a couple of weeks we'd be ready by Easter last year to
Oh,
undo
it's not.
everything.
It's well, be that as it may, it's hardly silly now.
It's hardly silly now. All right, let me get through some really quick things before we get into the main thing you want to talk. So let's fly through these pretty quickly, but I want to show a lot of the things that you sent to me. So
Okay.
first, the dreaded UK variant. Look at how those infections are rising.
Yeah, exactly. And it's not just in the UK, Mike. I just looked at a graphic from Denmark, and it's probably outdated. It's probably a higher percentage now. Their curve is the same sort of epi curve, dropping precipitously, and the UK variant is now 76% of their samples.
So just look at how it's
Same
spreading.
thing. By the way, same thing for Switzerland. I mean,
right.
it's just
it's so deadly. Look how many more people it's killing.
Well, Mike, I just want to go through this really quickly. There was a painfully, actually a reprehensible paper that appeared in the British Medical Journal, completely misrepresenting the mortality data, publishing something that should never have been published and suggesting that there was about a 65% increase in mortality. And I went through the paper very carefully, and I've been at it with others on Twitter. They didn't even adjust for comorbidities. And it turns out something you'd be familiar with now from from our weekly sessions. The variant group, for whatever reason, which was not adjusted for, had much lower cycle thresholds. And so they just throw this out there. And they don't mention the fact that there have been other studies in England itself, which showed actually a protective effect of the variant using the same kinds of analyses, and one that showed absolutely zero effect. But the bottom line was, even in this study, which is claiming a 65% increase, and that's a relative increase, the absolute difference between the two groups was 0.15%.
Yep.
I mean, so, and of course, I'm waiting for them to glom onto this at the update tomorrow. The paper just came out a few days ago, in Rhode Island as yet more panic pornography to keep us locked down, to keep us from, it's really, I'm at my limit, Mike. I've never seen anything like this. I have a 40-year career now in public health and in clinical medicine and healthcare, between my career as a physical therapist and a physician, and starting in 1980. And we were taught back then, it was already the prevailing paradigm, that you go by evidence-based medicine. You don't go by anecdote. You don't go by terribly confounded observations.
Well, everything they've done is evidence-based, Andy. Come on, don't you know that?
Yeah, no, I mean, I used to laugh too, but it's just, it's out of control, and it has real consequences when you're dealing with an epidemic, pandemic, and you're talking about things that were considered verboten in very recent times, like lockdowns and mandates, mask mandates, and things like that. And yet they keep doubling down on them, Mike. And this is what's so frustrating. And I really believe now, because I'm comfortable talking to you about political things too, I cannot get away from the fact that this is really, you see the concordance of forces, political, public health.
All right, we're going to get to that.
And the press.
All right, we're going to get to that. I want to get through these other graphs first. All right. So here, maybe this will cool your jets. I hope you'll see this as good news. I know you sent me some other charts.
Yeah, this is it. I sent you this too. Oh, okay. Well, anyway.
It's a slightly different one than you sent me, but this is, so Rhode Island is now at the head of the pack when it comes to vaccinating people 65 and older. That's good, isn't it?
And 75 plus, Mike.
Okay, great.
75 plus too. I just saw an update of 75 plus. And what that tells us, Mike, both of those numbers are over 65%, even 70% now. What that tells us is that we are doing what's physically possible to do to protect the most vulnerable. On top of that, Mike, if you look at the DOH website, there are at least, they chronicle at least 130 infections by tests. And let's say just, some of them are duplicates, but we know that roughly 2,600 persons in the state have died. So if you take that group that passed away out of that number, we probably still have at least 125,000 persons in the test that have recovered from COVID and contributing to herd immunity. But the CDC estimates that for each person that you identify as being infected, there are 5 that you don't identify. We could have over 600,000 people in this state that have been infected at some level. Now we're vaccinating the most vulnerable. That's why I argue that Easter Sunday should be our opening.
Yeah, I think that's very reasonable. In fact, I saw last week, I don't think we got to talk about it, I had it on my list, but Rhode Island was listed as one of 7 states.
Yes,
at over 60% who was approaching herd immunity.
Right.
So, we should be when you get to herd immunity, it's very hard for the virus to spread in any meaningful way, right?
It's certainly to spread in a way that's gonna hospitalize and kill people.
Right. Okay. All right, let's go on to our regular chart. So positivity rates looking stabilized, but at a pretty low level.
Yeah, within the margin of false positive error, Mike. I would put it that way. Honestly, we just don't know what it means. And again, we didn't succeed. We had sort of a minor victory where we got that data request on the cycle thresholds. But the idea of that was that it should be posted every day at the website. We're nowhere near that. But I guarantee you it would look very much like what we found. In other words, these tests are now in the range where it's probably at cycle thresholds, 30 plus, most predominantly.
Well, when we look at the next 2 charts, it pretty much proves your point that even though the positivity rates are staying the same, hospitalizations are going down, which means that, that people are not as severely afflicted, right?
Absolutely. Hospitalization. We've had
the same with deaths. Yeah.
We've had at least 2 days where there's been 0 deaths again. And thank goodness for that. And you actually, they show up as little notches. Mike, the 0 deaths show up as little notches on these charts. These are the hospitalizations.
Let me quickly, I forgot to share. So here's the positivity rate. I wasn't sharing the screen this whole time we're talking about. There's the hospital rates going down, and there's
and some of these notches in here, Mike. Some of these notches are zeros, are true zeros.
All right, so the picture continues to improve in Rhode Island. All right, let's stay on hospitalization. Well, so
yes,
why don't you bring in your why don't you bring in your political health press triumvirate that I'm calling the Iron Triangle theory into play as it relates to hospitalizations. Go ahead, Andy.
Well, I think we have, and it's sad to say this, but I'm convinced now. We have one journalist left in the state of Rhode Island. One. His name is Ed Acorn. Okay, he's the only journalist that has done actual investigative journalism of COVID. It's a tragedy. It's a travesty. It's a tragedy. What Ed did, and it was the last thing, by the way, that he published in Providence Journal before his early retirement, shall we say. This is it. What Ed did is, can you hold on this graphic here, right there? Can you just hold that up? This is what the Department of Health with Brown University, with the wonderful epi savants at Brown University and the savants in the Department of Health. This is what they predicted. Remember the whole basis of lockdowns and masking and all these other mitigation measures was to prevent the hospitals from becoming overwhelmed and overrun.
Right.
They actually believe.
Flatten the
They
curve while we
actually-
build capacity, right?
They actually put this out. This is what guided the policy, that we were going to have, in the conservative estimate, a peak of 22,000 people in the hospital for COVID at a given time on May 3rd, or
2,200, 2,200, 2,200.
2,250 or 4,300. Ed, we peaked at 375 during the first wave. Now for people to be 11-fold and six-fold off with their quote unquote models, and these are the same people that are modeling now that are going to tell us when we can stop these mitigation measures. Governor McKee has to know this. This is very important for him to know. Yeah, we peaked at 375 in the first wave on April 28th. Even with the second wave, where as we've discussed, Mike, the designation of what was a hospitalization was absurd.
But still nowhere near approaching even the conservative, the 2,250. Nowhere near.
That's right. And in the second wave, we have to remember the Department of Health admitted that people were admitted with medical conditions that had nothing to do with COVID and quote unquote tested positive, or had been previously admitted with COVID and now came back for some medical issue that had nothing to do with COVID. So COVID was part of their comorbidity sheet. And those were all counted as COVID admissions. But even with that overcounting, we never came close to these projections by the great savants in the Department of Health and over at the Epi department at Brown. And Ed is the only person who investigated that. He wasn't brought, the media didn't come to him and talk to him about that. He did the same thing with cycle thresholds. You know, when you and I and Representative Morgan were all putting in our requests and were initially rebuffed, and we discussed this and what was going on, I never got a phone call. Worse still, Mike, when the data was released, and even when I published the data in a preprint, in an academic preprint on a medical server that's widely used, I was never called for an interview to discuss the ramifications of these data by the lapdog press. All they do is regurgitate.
That goes back to your triumvirate theory, right?
Yes, all they do is regurgitate the same talking points that you hear at these briefings and updates. It's an absolute disgrace. And unfortunately, Ed's retired. So he's working on his books now. So he doesn't want any part of this. He had a belly full. But this is the problem, Mike. When you have sycophants covering the public health department and covering the governor's office, you get nowhere. And the public gets no information for them to weigh and judge themselves.
Well, we also know that the national sycophants, in addition to the local sycophants, told us that wearing masks would make a big difference. Well,
right.
Look at that.
Exactly. And that's on top of denying. And now I'm not talking about the press, although the press, I mean, they shouldn't be so unsophisticated and lazy. That's after denying the fact that since 2008, including COVID itself, we've had 12 randomized controlled trials that looked at masking versus non-masking in controlled settings, all kinds of settings outside, medical centers, Hajj pilgrims, university students, household contacts. Every single study has been negative. Now, going back again to my initial training, going back to 1979, 1980. So for 40 years, the paradigm is that if there is a question about an intervention, from something as complicated as a vaccine to something as simple as a mask, you adjudicate it ultimately with randomized controlled trials. I have never heard of anything that went through 12 years and 12 negative trials and was still forced down people's throats. This is just not appropriate. Never heard of it.
How did Ronald Reagan say it? When the government planners' plans fail, the government planners plan more.
Yeah. Well, I heard a very poignant testimony by a father in Ohio protesting the renewal, I guess, of Governor DeWine's own draconian mandates. And what he said is it's enough. We are being treated, the Ohioans are being treated by the Ohio Department of Health as if we are hospitalized patients who have given up our right to informed consent. And I thought that was a perfect way to describe it, because the procedures being imposed upon us en masse, are not with our consent. When you're a patient in a hospital, if a physician is adamant that a particular diagnostic procedure or biopsy procedure is important to his care, and the patient is afraid and wants an alternative and just doesn't want it, you don't have the police come in, tie the person down, and do the biopsy. I mean, it just doesn't work that way, Mike.
Yeah, informed consent. Yeah. All right. All right. I want to cover a couple more issues with you. One that was brought up on our discussion thread by Claire. I don't know if she wanted me to ask you about it, but I will. So I think it's interesting. What about travel, especially international travel? I mean, so talk to me. Are other countries seeing the same declines we're seeing? Do you think it's safe to open up international travel? What is your view on that?
Yeah, I think that these declines are taking place all over the world. You do have to be aware of hotspots. I think South America is still maybe a little bit behind us. Brazil in particular, they looked like they were about. I know I looked at their epi curve the last time. It looked like they were maybe 6 weeks or so behind us. So they'll come down. They'll come down, but you can look at the epi curves, Mike. You can see the places that are right about peaking now, as opposed to where we're way on the descent curve. And I think that's it's kind of straightforward. That's where you make these judgments.
Have you seen any indication that international travel is either being loosened because of the worldwide decline or being tightened because of these false fears over these variants?
If anything, I still think the variants are driving what's going on. I honestly haven't focused on that particular issue, but when I hear about what the European countries are doing to each other, it's all sort of a fear narrative driven by, oh, we don't want this variant to get into our country. Meanwhile, they get in, and if they're on the downward part of the curve, they do okay. It is a little disconcerting though, considering that they're still behind in South America. Certainly, maybe I don't know how Central America is if they're behind, but South America is a little behind. That we have the destruction of our border and the inability to test the traditional way for immigrants. That this goes back to Ellis Island. I mean, you had to be tested for possible infections.
All right, I got another question. I think she meant Andy from Louise. He asked how to Larry, but I think she meant Andy. So you are of Jewish background. You talk often about issues related to that. The question is, and I don't even know if this is true, how does Andy feel about mandatory health passes like in Israel?
I don't like what's going on in Israel whatsoever. So, and I have plenty of sympathy for Israel, and I consider myself a Zionist, but how they've handled COVID, I have no sympathy for what they've
Very heavy-handed?
Very, very, very heavy-handed. And, I'm not sure with their experiment on mass vaccination of pregnant women, if that's particularly wise. They had a few scary cases. Some women got sick and were hospitalized. But I mean, overall, pregnant women, going back to the beginning, to the first wave, have done quite well with this. And again, but the bottom line is, in terms of vaccinating them, none of pregnant women were not included in the trials for the Moderna and the Pfizer vaccines. It's risky. It's risky. No, so I'm not a fan of what's going on in Israel. They've had 3 lockdowns. It's kind of turned me off.
All right, I got one more sort of medical related question for you, and then we'll play a little politics, sort of, to follow up on what my opening commentary talked about. So here's an article I saw that I wanted to ask you about. say it for you. Lasting immunity found after recovery from COVID. Initially, of course, the fear mongers wanted everybody to think, oh, once you recover, even though often it's a long time, this might only be 3 to 6 months. What are you seeing in this area?
It's absurd. So there's the epidemiologic evidence and there's the laboratory evidence. The epidemiologic evidence, since I'm an epidemiologist, I just happened to have looked at data from Israel. Speaking of Israel, the UK, Austria, and Qatar. So, a variety of countries, Middle Eastern countries, European countries. The total number of persons followed. These were persons who'd been infected in what was the first waves that afflicted these countries, the first COVID waves. And they were followed, I think, even out to 10 months in the case of Qatar, but for months at a time. And the reinfection rate, the raw reinfection rate, taking a weighted average of the different populations in the countries, Mike, was less than 0.25%. 0.25%, which means 99.75% did not get reinfected. I mean, that's better than a vaccine.
And how long does that last for?
And the follow-up in the case of Qatar was out to 10 months. But we're talking about months.
And is that typical for a virus that a natural immunity after you have it would be about a year or a little under, or do some last longer?
It can absolutely be that long. And then the laboratory evidence is more interesting, because the laboratory evidence suggests that both T cell immunity and memory B cell immunity. Remember, we have B cells that produce antibodies that are relatively short-lived, and they can rise and spike, and that's the kind of immunity that can, in fact, at least by assay, by testing, disappear within a few months, within 3 months or so, and that's what the panic pornographers latch onto. Well, there's also memory B cells besides the T cells, a whole separate form of immunity. Well, they're now finding that the memory B cells from the first wave are active against the variants. So are the T cells.
Okay.
This is all laboratory, Mike, but it's all we have at this point. Yep. It may or may not pan out, but we're kind of seeing that when you see that the epi curves for the second wave, even with heavy infiltration by the variants, are not changing. South Africa with a South Africa variant, they're not changing.
So with this 8 to 10 month period of immunity after recovery, lead you to believe that the vaccines themselves will have an 8 to 10 month or longer.
Probably the one study that looked at T cell immunity also in vaccinated persons. Done by one of our most prestigious, institutes of virology at La Jolla. They, again, in a laboratory, model, in a laboratory setting, they found that the vaccine-induced immunity by T cells was very robust too.
Okay.
So that's a reassuring finding anyway.
Let's venture into opinion politics. My main commentary today was about how woke equals weak, how the woke left, they're just too insecure emotionally to deal with anybody disagreeing with them or any perceived injustice on anybody else. It might have all derived from the trophies to everybody mentality that we grew this generation of kids up on. So here's my question. We know that it's the woke who are most afraid of the coronavirus, the ones who dutifully and happily wear a mask and lock themselves down and don't travel and whatever.
Okay, go ahead. I think there's a variant on that.
Is this whole, well, other than people who have,
I mean, think of the Black Lives Matter riots over the summer. Those people didn't seem to be very afraid of COVID.
Well, yeah, okay, yeah. But so was this whole, what did you call it? What would you call it? Porn?
Panic pornography.
Was this whole panic pornography about catering to the woke left?
Well, I think it's contributed. I think it's contributed, and the masking is now emblematic. it's a talisman of compliance and fear, and that's why I find it just so unconscionable that it's being imposed on children, because it's gonna raise another generation or a new generation of extraordinarily fearful young people. It's just awful and guilty. They feel they have to wear the mask because otherwise they'll kill grandma.
Yeah.
I mean, this is just absolutely awful psychology.
Yeah. All right, Andy.
And I have to tell you, Mike, my wife is a very accomplished academician, more accomplished than any of the people in the Department of Public Health. I say that openly, and it's true. Older, more experienced, more accomplished than any of them by far. She wears a Hamza. A Hamza. It's a Middle Eastern symbol with an eye. It's to ward off the evil eye. Jews wear them, Muslims wear them, Christians wear them from the Middle East. She has as much right to impose that on others as they have to impose masks on others.
All right.
That's just
Andy
the way it is.
Bostom, thanks again for joining us. Another great discussion. Thanks for responding to our YouTube commenters. Is that the right word? Whatever. Those who put comments up. All right, Andy, we'll talk to you next week.
Always fun. Take care, Mike.
Yep.